Well, good morning, everyone. We are about to launch the 11th annual Copa Health Emergency Preparedness Workshop or Conference. My name is Stan Spitek, and I've had the privilege of being a consultant focusing on emergency management and emergency preparedness with Copa for about 10 years. We think that we put together a program today that is really going to keep your interest. It's going to motivate you. It's going to inspire you. It's going to make you, especially if you're one of those representatives from an organization here today that serves a vulnerable population, which in some sense we kind of all do. It's going to make you want to really put some more focus on your organization's level of preparedness and resiliency. So, before we get into the program, there are typically some housekeeping instructions that we're going to need to talk about. We want to be cognizant of any potential emergency situation, so make sure that you've got some situational awareness to your exits. Should the fire alarm sound, we're not going to just sit here and look at each other and try to figure out what we should or shouldn't do, but we are instructed by the hosting venue that we will exit out of either door out here to my left or my right. We'll congregate out on the sidewalk and we'll wait for an all clear. I also want to bring your attention to some of the things that you received today upon registering and entry into this great conference. We're really proud of the resources that we put together for these types of conferences, and our team has put a ton of work in putting together a resource book that will address the topics that we're going to talk about today. In addition to that, I've never gone to a conference where I've got such a cool bag with that battery charger and those cables. You know what? This is all about resilience today. And personal resilience is something we've always got to consider. So we're hoping that that little emergency kit that we gave you is going to be a good resource for you. The bathrooms are outside the door there and down the hallway to your right as you're going towards the main entrance. Again, kind of an organic, action-packed workshop that we put together today. We've got some really tight presentations with multiple perspectives, a lot of panel discussion, and most importantly, we want to hear from you. So we've got microphones if you've got questions, especially to some of the subject matter experts that we've put together today. Let's make this a really resourceful, entertaining, educational kind of program today. One of the things that we've integrated into each of the programs that we've done the past several years is that we're going to give away some cookies. There'll be a raffle at various points throughout the day. Everybody received a raffle ticket, and you are up for some cookies. Norm, let's talk cookies. What is so special about the Copa cookie?
They're delicious. You know, one of the things about Copa Health that is so exciting is our innovation. In fact, it's one of our primary goals, primary purposes to be innovative. And my good friend Janie Durham had an opportunity to lease some space, and when they had an industrial kitchen there, she's like, okay, we don't need to move that stuff. Let's start a cookie company. Our Copa cookies are so fantastic, and I believe
right
we're
here.
going to have a...
Here's the Copa cookies.
Oh, Copa cookies. By the way, this is the first time I've had them in my hand where I haven't eaten them. I was a very thin man before Janie came up with Copa cookies. But listen, there's several different ways that you can purchase these. We have a QR code that's going to come up later. You can scan the QR code, or you can go to Copa Health's webpage, copahealth.org, and there will be a link to Copa cookies. But these are wonderful. These are made by our members. So we do a lot of work in the culinary arts. We run a restaurant. Janie and her team provide sandwiches for many of the jails here in Maricopa County, and Copa cookies is probably the sweetest thing that they produce, and I love them. So if you ever need them for an event or just to have them at home, go ahead and check them out and buy them.
So Norm, you are going to kind of give an overview as we launch this program today of the rich history of the evolution of the Emergency Preparedness Conference. It started out small with a tabletop exercise about 11, 12 years ago. It evolved into a full-scale exercise where I think you had an explosion in a boiler room. And now its genesis has evolved to a conference where we see leaders in emergency management, emergency preparedness, organizations that serve vulnerable populations. They're all right here in the room today.
Yeah, just so you know, it wasn't an actual explosion. It was a mock explosion, Stan. If it had been an actual explosion, we would have to go back to the 1950s when we had boiler rooms. But it was very interesting. So when I first started at Copa, I was in the IT department, or actually I worked with people in the IT department, and one of the things that I was asked to try to help out with things like walkie-talkies for our vans, cell phones, GPS, stuff that really at the time was sort of just getting into the vernacular of our population. But when it comes to vulnerable populations, we wanted to do more, and I learned about the incident command base system training from people like my good friend Gil Damiani, who's going to be up here later, Ray Morris, and also my good friend Stan, who I've known for many years now. And we decided to do a tabletop exercise where we invited the Red Cross, Salvation Army, people from the state, people from FEMA. We had about 20 people around the table, and it went so well that they all asked us, are you going to do it again next year? And then we had the mock explosion like Sam was talking about, good exercise. Year after that, we did a active shooter drill. It was it was very impactful, very amazing. And then from there on, we just kept turning it more and more into a conference. We've had fantastic guests throughout the years. So you can see 2014, this is our 11th year doing this. We've had people like Frank DeAngelis, who is the principal of Columbine. We've had individuals like Lieutenant Joe Cirillo, who was the only person who was trapped in both the towers on 9/11. We've had experts like Tommy Holmo, who was is the BYU athletic director, talking about the effects of COVID. And when COVID came around, actually right before COVID came around, the state asked us if we would focus on infectious disease control. So we came up with, in 2019, the summer, planning for a pandemic. A lot of people blame me for the pandemic because we came up with planning for the pandemic. And each year we've tried to move on to a little bit different portion of the subject, and sometimes it was dealing with infectious disease control, sometimes it was dealing with fire. But one of the things that we've been asked year over year is cybersecurity. I can't think of another situation where something that happens on the other side of the world, somebody that something's doing on the other half of the world, 12,000 miles away, can affect the things that we do now. But we can have systems shut down, we can have electricity go down. We've had problems with healthcare payment systems. In the past 6 months, we're going to have the CEO of Mercy Care and the CEO of Copa Health up here, Tad Gary and Char Rajavi Piper, talking about that. There's so many things that are affected by the technology services that we have. And when they asked us, could you focus a little bit on cybersecurity? I said yes. My initial thought was really that's not an emergent situation, but then when we started looking at all of the things that happen in a cyber situation, emergencies and communication through events that are happening, we just said we're going to go for it. So this is our 11th year. We're very excited. I really want to thank, before I get started, I want to make sure everybody knows that Jeff Baer, who works with me, has worked with me for 10 years, pretty much puts this conference together. He leads the effort, and if anybody gets a chance to meet him, he's just a great guy. So that's what I've got, Stan.
All right, Norm. Well, one of the things that always makes me nervous, and sadly, it came to fruition yesterday. It seems like whenever I'm doing an emergency preparedness conference or a workshop, there's always some type of event that makes it even more impactful. And then when that breaking news came across the line yesterday of a shooting in a school in Georgia, worst fears did come true. We're going to talk a little bit about that today in our communication segment. We're going to talk about information and getting it right. We integrated other presentations into this program, not only focused on things that we can't see, but things that we should do. And that's why I'm really excited about having a representative here from Scottsdale Fire, who's going to talk a little bit about citizens coming to the call to action in an emergency, and specifically about the Stop the Bleed program. Some of you, this might be second nature and might serve as a good review or a refresher, but some of the vulnerable populations like those represented here today, assisted living, long-term care. We've got representatives here from a long-term care association, another vulnerable population. Maybe you'll be inspired to reach out to our community resources at a trauma center or at the fire department and get Stop the Bleed integrated into your organization. Getting ahead of myself a little bit, Norm, but I'm excited about this conference, and I'm really excited about this first panel that we're going to launch.